hello there. Please do come on in and take a seat for me. My name is Bryoni. What's your name? Oh yes, right on time. Okay, and just before we begin, just confirm your date of birth for me. Perfect. So can you tell me a little bit about what's been happening, what you've been experiencing, what brings you here today? Okay, so it's your eyes. Okay. Okay, so it's more like a routine checkup, more than anything. Okay. Now, is there anything that's been bothering you? Anything that's been happening regarding your eyes? Or any noticeable sort of changes? Any changes with your vision or anything? Okay, alright, that's fine. Have you been experiencing any blurred vision? Double vision? Any watering from the eyes? Redness? Okay. And anything at all that you're generally concerned about? Okay. Alright, well it seems like it's just going to be a little routine check for you. Okay? Wonderful. So, do just make yourself comfortable. Okay? So I'm just going to put on some gloves. Okay, is it alright if I just come a bit closer, just have a look at your eyes? Wonderful. Okay, so I'm just having a look, just look straight at me. Alright, now is it okay if I just have a little feel under your eyes? And around. If you have any pain or discomfort, please do let me know. Alright, they generally do look okay. What I would like you to do, could you just look it? Look it. 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 Good, now just look it. Look it. Okay. 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 Very good. Okay. How many fingers am I holding up? How many? How many? How many? Good. 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 Okay, just look it. Look it. Okay, now just blink. 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 Okay, just look at my hair. Look over here. Look at my mouth. Look over here. Look at the light. Look at my nose. Look here. Look at my hair. Look here. Look at my ear. Look at my mouth. Look here. Look here. Look at my mouth. Look at my ear. Look here. Look here. Look here. Look at my mouth. Look at my ear. Very good. Okay. How do your eyes feel? Do they feel okay? Okay. I'm generally quite happy with the way they're looking. What I'm going to do though, I am going to just give them a little clean. Okay. This is just routine for me to just clean around the eyes just to make sure there's nothing in your lashes and just to check that they're definitely clean. So, I'm just going to use this cleansing wipe. Don't worry, it won't hurt. Just going to wipe. Okay, on the other side. Okay, just going to Okay, just close your eyes. Close your eyes for me. I'm just gonna Very good. That should feel a bit refreshed. We'll just let that dry. That should be nice and dry now. What I'm going to do, I'm just going to use a light, okay? So first of all, I want to just have a look into your eyes. Do not look at the light. Do not look at the light. Do not look at the light. Look over here. Do not look at the light. Okay, look over here. Do not look at the light. Okay. On the other side, look over here. Do not look at the light. just look up for me. Keep looking up. Okay, look down. Can you look that way? Look the other way. Okay, look that way. And look the other way. Okay, look up. Okay, look down. Okay, just blink. Blink. Okay, just look over here. Your eyes look fine. Okay. This side. Good. Okay, just blink, blink. Just want to try something. I just want to see how well your eyes respond. Okay. Okay. Just come a bit closer. Okay. And this side. Very good. You can blink if you need to. Now just look at the light. 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 Okay. Now just follow the light. Follow the light. Follow the light. Just follow the light. Following the light. Follow the light. Very good. Please blink. 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 Okay. Next I want you just to look at this blue pen. Okay? Now I want you to just look at it when you see it, okay? Look at it. Good. 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 Very good. Now I want you to follow it, okay? Follow the pen. Follow the pen. Very good. Okay. I now would like you to just read this eye chart for me. Try your best, okay? What's this one? Good. This one. This one. Good. This one. Good. What about this one? Good. Okay. Now the next one is to really test you. What about this one? Well done. Can you do this one? Okay. And this one. Well done. You did really, really good there. It's good that you tried. So I have a lens here. And I just want you to tell me if it's clear with or without the lens, okay? I just want to see whether or not you may need a thorough eye check and perhaps some glasses, okay? So ready? This is without. This is with. So is it clear without? Or with? Without? What do you think? Again? Okay. So without. With. Without. Is it about the same? Interesting. Okay. Well, I think your vision is absolutely fine. You have perfect vision. What I am going to do, I'm just going to pump some drips into your eyes. They're looking a little bit dry, and these will just help them, okay? They may have just dried out just from your concentration. So we'll pop a few drops in your eyes and that should help you out. Okay. So I'm just going to drop this side, drop. Just blink, just hold it there. Hold it, hold it, hold it. Very good. Well, your eyes do look absolutely fine. They look fine to me. Your vision is great. They responded well. Little bit dry, but that's expected with all of these tests. Okay? And you've been concentrating a lot. I'm generally quite happy. Okay? If you did want to have a thorough eye check to see whether you need glasses, please do come back, okay? But it will be a much longer appointment. Yeah. Alright, well that is all for today. Thank you so much for visiting. It was lovely seeing you. Bye bye.